everyone? Hearty and healthy? Okay, ready for part 2 of HEMAT? Let's continue. The first condition we are going to treat is nausea and vomiting. Okay, so in this we have chemotherapy induced nausea and vomiting, right? Chemotherapy induced nausea and vomiting. So it can be of three types, as you know. Number 1 is early onset, number 2 is late onset, and number 3, anybody? Number 3, it is anticipatory. Number 3 is anticipatory. Okay, so as we know, the early onset occurs within 24 hours, delayed more than 24 hours. Anticipatory occurs before chemotherapy because of the memory of the last episode, right? So the drug of choice will be, to decrease anxiety, it will be benzodiazepines. Now the first one, that is early onset, we can use drugs of the class 5-HT3 blockers. So they are number 1 first generation drugs, and the second other generation number 2. So in the first generation drugs we have ondansetron, granny, and alosetron, whereas the second generation, these are palonosetron. Why this drug is so desirable? Because it's more specific, more efficacious, and having less adverse effects. So it is the drug of choice. The only problem can come somewhere is that it has to be given by IV route, okay? So all of these drugs, since they are having the same class 5-HT3 blockers, they will have common adverse effects. And these are, number 1, the most common is constipation. Number 2, they can cause QT prolongation. So again, I told you there is a lot of communication between the stomach and heart. Okay, so again, QT prolongation, which is most common for ondansetron. And they are unsafe in pregnancy. Okay, so this was really simple and we are done with this. So at the end of the day, we realized that palonosetron is the drug of choice because adverse effects are least, efficacy is maximum, the specificity is maximum, but it has to be given by IV route. Now there is delayed nausea and vomiting, delayed onset. This is in this we have a little different management, such as we can give number 1 neurokinin 1 inhibitors. They are also called substance P inhibitors. They actually inhibit substance P, and substance P activates neurokinin. So if substance P is inhibited, obviously neurokinin 1 will also be inhibited. So these drugs are aprepitant, fosaprepitant, and rolapitant. So out of these, aprepitant can be given by both oral and IV. Fosaprepitant is only given by IV route, and rolapitant, it is having a long half-life, more than a week, more than 7 days. These drugs have increased lipid solubility. They can reach into your CNS, and apart from that, they are metabolized by the liver cytochrome B3A4. So there will be a lot of drug and drug interactions. And again, oh man, it's too much. Again, QT prolongation is occurring too much, right? Like for almost every class of drug, it's there. Every class of drug, even like we have started nausea vomiting. In case of early onset nausea vomiting, we are giving the ondansetron group. So here also QT prolongation. For delayed onset nausea vomiting, we are giving neurokinin 1 inhibitors. Again, there is QT prolongation. So it's very easy for us to remember this, isn't it? Okay, then there is olanzapine. Olanzapine can be given, which is again a 5-HT3 inhibitor, and it is an atypical antipsychotic drug. Then third option can be dronabinol. It will inhibit the cannabis receptor 1. It will activate the cannabis receptor 1. And the fourth drug may be dexamethasone, but the mechanism we don't know. Now there is morning sickness. In case of morning sickness, we can give morning sickness, we can give doxylamine along with pyridoxine, vitamin B6. That is a drug of choice, doxylamine with vitamin B6. Okay, so there are other causes of nausea, vomiting. We have to give D2 blockers. We can give number 1 domperidone, number 2 metoclopramide. Metoclopramide, first we'll discuss. It is lipid soluble, so it will reach the CNS. It will cause CNS toxicity. It also inhibits dopamine receptors. So obviously it's a D2 blocker. It will also inhibit the dopamine receptors in the CNS, in the brain, and because of that dopamine will decrease. So which hormone will increase? Prolactin. So there will be hyperprolactinemia. And number 2, because of dopamine deficiency, there will be extrapyramidal symptoms. So therefore, this drug is never ever to be given in children. It is unsafe for children because children, they have a further not properly developed blood-brain barrier. So it will cross even faster in children. The second is domperidone. So it is lipid insoluble, therefore safe in children. Okay, there is a condition of motion sickness. Also in motion sickness, we usually give a patch of hyoscine, also called scopolamine. Okay. Why have you shrunk the image? Okay, so now the second condition is GERD. In GERD, we can we can help the patient in two ways. Number one, we can decrease the acid, and we can increase the forward propelling of acid and the food contents, everything, that is by increasing the peristalsis. So decrease the acid, again, proton pump inhibitors, their drug of choice, followed by H2 blockers. Now increase the peristalsis. These are 5-HT4 agonist activators. Okay, 5-HT4 agonist. These drugs are prokinetic drugs. So cisapride, mosapride, mosapride. I'm coming to that pharaoh connection. So cisapride, mosapride, etopride, all these pride drugs. And then we have tegaserod, domperidone, metoclopramide. These are also having this prokinetic property. Oh, not again. Yes, but it is there. Even these pride drugs. Thank you. QT prolongation, and it is the maximum for the cisapride. Therefore, it's no more used. It can even cause Torsades D points. Okay, now coming to macrolides. In macrolides, we have erythromycin. This activates the gut motility and causes diarrheas. So it is activating motilin receptor. If you remember, if you have seen my antibiotics lecture, in antibiotics lecture part 1, when we were doing the adverse effects, I told you one of the common adverse effects. In that, I told you about diarrhea. I told you for diarrhea, there are 3 reasons. Does anybody remember? Number 1 reason was the alteration of the gut flora, that pseudomembranous enterocolitis, Clostridium difficile associated diarrhea. Number 2, I told you there is osmotic diarrhea because the gut, because of the changes in the gut flora. What is happening? These carbohydrates, they cannot get absorbed, and so because of that, there is osmotic diarrhea. And number 3, I told you that some drugs have direct effect causing diarrhea, such as erythromycin, which activates a motilin, and this motilin increases the gut motility, and this is another reason for diarrhea. So there were 3 reasons for diarrheas. Okay, so there also we discussed this macrolides, erythromycin, it activates the motilin receptors. Okay, now coming to diarrhea. Wow, this is the second last topic. Only one will be left, which is again a part of diarrhea only, that is irritable bowel syndrome. Okay, so what is the treatment of choice? The treatment of choice is actually fluid therapy along with drug therapy, which is plus minus. Not every patient has to be given drugs, but fluid every patient needs who is having a fluid loss, who's having dehydration, who's having diarrhea. So we can give it through IV ringor lactate, or through oral we can give ORS, oral rehydration. Now coming to drug treatment. Okay, so in case of drug treatment, if it is infective etiology, we can give fluoroquinolones like Norflox. If it is non-infective, we give loperamide. If it is secretory diarrhea, we can give octreotide more than zinc. Zinc, especially in children, we give, so octreotide more than zinc. And if the patient is a traveler, a tourist coming to maybe from, say, America, coming to some Middle Eastern country, so in case of travelers diarrhea, we give bismuth subsalicylate, BSS, bismuth subsalicylate. So it inhibits the prostaglandin, so there will not be any vasodilatation, there will be decreased secretion, so there will be decreased diarrhea. Okay, so for travelers, we have bismuth subsalicylate. It's not bismuth subcitrate. That was CBS, bismuth. Wait, that was CBS? Yes, colloidal bismuth subcitrate. Oh yeah, CBS, colloidal bismuth subcitrate. And this is bismuth subsalicylate. So BSS. Okay. Is it clear? So tell me, let's review. If it is an infective diarrhea, fluoroquinolones. Non-infective, loperamide. Secretory, octreotide more than zinc. And if it is traveler's diarrhea, bismuth subsalicylate. Yes. Whoa, the last slide. So coming to irritable bowel syndrome, it can be diarrhea dominant or constipation dominant. In case of diarrhea dominant, the drug of choice is tricyclic antidepressants. In case of constipation, it is SSRIs. So like C and S, you know, they're having some similarities. So you can remember CS like SSRI, like constipation. Okay, constipation dominant, SSRI are the drug of choice, but along with that, we can combine some other drug. So in case of diarrhea, which drug can you combine? Of course, loperamide or rifaximin. It is the antibiotic of the rifamycin group, and one of its very few indications is irritable bowel syndrome. So the first drug of choice is, of course, TCAs. Along with that, you can give loperamide or rifaximin or even clonidine. And here in constipation, we can give SSRI as a drug of choice, and we can combine it with linaclotide or plecanatide. These drugs, they activate the guanylyl cyclase enzyme in the GIT. There is increased cyclic GMP. There is vasodilatation and again increased secretions. Another drug which may be considered for constipation, predominant is lubiprostone. This lubiprostone, what it does, chloride channels are activated, so there is more chloride influx and there is vasodilatation. Okay, so it has to play with the chloride channel activation, so there is more chloride channel activation, and there will be obviously more chloride in the lumen also, and there will be a relief for this constipation. Okay, so let's have a look at the images now. Yeah, so this is to show that palonosetron, it is a second generation drug that is a 5-HT3 blocker, and it has to be given by IV route, but yes, it is the drug of choice. This is aprepitant. It is a neurokinin 1 inhibitor. It is used as a drug of choice for delayed onset nausea and vomiting. Yeah, what is this? Doxylamine with pyridoxine and folic acid. This is used for morning sickness or the morning sickness or nausea and vomiting in case of pregnancy. Okay. What is this? A child has to eat this tablet for nausea and vomiting. That means it is a revision for the fact that metoclopramide never ever to be given in children, but yes, domperidone can be given in children. It is safe because it is lipid insoluble. So this little girl is probably eating domperidone, though we know she's just acting. Now, metoclopramide, it is not to be given, but other indications are there where it is used as a prokinetic. It may be used in GERD. Okay, yeah, so this is Pharaoh. So actually, who was the best friend of Pharaoh? Moses, right? Best friend or like best foe? Of course, the second option. So this is just an indirect way of talking about mosapride. Mosapride, it is a prokinetic drug which is a 5-HT4 agonist, and this drug, like other pride drugs, again will cause QT prolongation. The other thing with the Pharaoh was that tomb, and the tomb, what is tomb? Yes, I hope you remember, it was a quadruple regimen for H. pylori. T was for tetracyclines, O was for omeprazole, M was for metronidazole, and B was for bismuth. And how were we giving BD for 14 days? Yes, this is loperamide. It is used for diarrheas, right? It can also be combined in case of diarrhea, dominant IBS, irritable bowel syndrome. Yeah, octreotide, you can see octreotide injection. It has to be given. It can be given in secretory diarrheas. This octreotide is also the drug of choice for bleeding esophageal varices. This is how linaclotide works. We know it is what it does. You can see GC, that is guanylyl cyclase activation, so cyclic GMP and more secretions. And this is how lubiprostone works, by activating the chloride channels. So there will be more chloride channels in the lumen, and so more chloride will take along with more water by osmotic action, and so there will be a relief in case of constipation. So yes, thank you. And study well, study smart, take care, stay healthy, and thanks a lot for watching. So please do like, subscribe, share and comment.